Senator Millett, Representative Cornfield, and distinguished members of the committee, my name is Elizabeth Shardlow, and I live in Kennebec County. I'm here today to provide you a very brief summary of the Maine CDC data on school vaccinations. When comparing the CDC data on actual vaccination rates across the country, it is clear that we don't have the 7th highest exemption rate, but in fact we have the 4th highest overall vaccination rates of all the states that have both religious and philosophical exemptions. Since 2015, the last time vaccine exemptions were before the legislature, the kindergarten vaccine uptake rate has increased for every school vaccine, some by nearly 5%. The MMR uptake rate has increased from 89.9% to 94.3%. DTaP has increased from 94.4 to 96.5%, and varicella has gone up from 93.8 to 96.5%. This year's kindergartners ranked Maine the highest in the nation for vaccination coverage when they were toddlers, as was published in the Bangor Daily News in 2017, and I've provided you that article. I've provided you with the CDC MMWR, which is the Morbidity and Mortality Weekly Report for the 2017 to 2018 school year, which is the source of the 7th highest exemption claim, as well as the data where you can see just how high Maine's vaccination coverage actually is. Some places like Washington, D.C. report a 5% exemption, yet 20% of their children are not vaccinated. Colorado has only an 88 to 89% vaccination rate, but doesn't report exemptions at all. Maine simply reports every child who has an exemption on file, even if they are fully vaccinated for all other vaccines. Our vaccination uptake rate among school children is the highest it has ever been in the history of this state. Despite this, there is increased concern about pockets of children in some schools. However, when you look closely at the data, which I've also provided to you, you will see that half of these schools have very small grades, less than 10 or 20 children. In those classes, if one child hasn't received their 4th dose of a vaccine, they will be counted as exempt and bring their school's reported vaccination rate below the 95% threshold. In a third of the schools with 5% or greater exemption, just one child is exempt. Yesterday, the Portland Press-Herald published an article reporting that there are 31 public schools in Maine with exemption rates over 15%. This is inaccurate. There are actually only 24. Of these, only 7 schools had kindergartens with more than 20 students. It is important to understand that the focus on kindergarten rates is a little misleading, given that the final dose of all school vaccines is given between 4 and 6 years. Thus, some kindergartners who enter school at 4 or 5 years of age simply haven't finished the series. We have historically seen the vaccination rate go up in 1st grade and again in 7th grade, and you can see that in the Maine CDC data. Before removing tens of thousands of Mainers from their daycares, schools, and places of employment out of completely unfounded fear, we must look at the data to justify such a drastic measure. Where is that justification with the highest vaccination rate the state has ever seen? I ask that you oppose LD798, and I appreciate your time, and I'm happy to answer any questions you may have.
Ms. Shardlow, you state here in your testimony that Maine ranks 4th highest among states that have both religious and philosophical exemptions.
Correct.
But that excludes those with only religious and none, correct?
Correct. We rank 30th highest in overall exemption rates of all. Wyoming did not report, so it's 49 states in the District of Columbia. We're 30th highest in exemption or 20th highest in vaccination, depending on how you look at it, of the 50 reporting. And I've provided you with a breakdown. I've given you both the MMWR report with the data, and then I've given you a further breakdown where the data is sorted not just by state, but also by vaccine, and also among the states that do have both exemptions.
Are there any other questions? Representative Farnsworth.
Thank you, Madam Chair. I appreciate all of the data that you've given. Can you give me a little bit of your background, because it's obviously more sophisticated than just the standard, high school graduate.
I appreciate that. My background, I'm a small business owner. I'm a mother of 4, and I'm a full-time college student at the University of Maine at Augusta. And in my spare time, I like to geek things out with vaccine data.
Senator Pouliot.
Well, first, I just need to say there's some pretty sophisticated, successful, and exceptional citizens in this country that are just high school graduates. So, on this list, there's 29 states that have, vaccine effective exemption rates
Correct.
that are worse than the state of Maine.
Yes.
Is there some data you could provide for us for the work session that shows if the incidences of outbreaks or negative impacts are worse in those states? I mean, I look at the District of Columbia, and of course, there's a lot of problems going on in DC. But I would like to know, if there are more outbreaks there, are there more problems? I mean, 20%, nearly 20% overall
Yeah.
exemption rate. It just seems to me like if these states have all these exemptions going on, that they would have more problems, but I'm not sure that that's really the case.
Right, so the real crux of that is, and it's going to vary by state. Every state, we learned that we were looking at the flu vaccine, every state on their state website, and it varies, sometimes you have to dig deeper to find it, but they do basically weekly updates, especially during flu season, and they track all of the vaccine preventable diseases. So it'll vary by state, and the District of Columbia has their own health department. What's important to understand is that this issue of the exemption rate is that Maine reports every single child that has an exemption. And so you'll have children who have exemptions but are also vaccinated. There's an example, one of those 7 schools that are big pocket issues. Henry Kitchell School in Monmouth has a 19% exemption rate, and they have like 40-something kids in their class. It's in their kindergarten. It's a fairly substantial exemption rate. However, they have 100% vaccination for varicella. They have a 91.5% vaccination rate for, I believe that's polio, and their others are 85.1 and 83. Like these children are not unvaccinated. They just haven't finished that series. And Henry Kitchell School is one of those pockets that we look at and we panic about, and that the Press Herald did the article on. It is impossible. I mean, it has to add up to 100. It's impossible to have a child who is both vaccinated and exempt in the data that the CDC puts out, if you're really understanding that they have we're the 7th highest in the nation. It's not. It's just that we are really good at our data. And you can see that, again, by looking at the actual vaccination rate compared to the ones that are not vaccinated. In fact, in the MMWR report, there's actually a graph, and there was an errata that was filed that impacts that graph, but it is not attached because it didn't change Maine's data. So I didn't print that one out. I obviously spent some time copying. But there's a graph where you can see the states that have these big gaps in missing data, and Maine is not one of them. We have 100% of our kids accounted for, maybe 99.99. But it's just because we do such a good job at reporting. But our actual vaccination rate, which is what we need to look at if we're concerned about herd immunity, is abundantly clear.
Thank you. So I'm looking at some data from the CDC, Maine CDC, where it identifies the numbers of medical exemptions, the number of religious or philosophical exemptions.
Yes.
So it appears to me that they are actually counting exemptions, not where students are along in their progress.
Correct. Correct. And that's one of those pockets. I mean, you can look at this for every pocket. I printed it out in 1200 DPI, so you can use a magnifying glass, which is required, but you can actually see it. And then that colored graph that you're looking at, Senator Millett, is a breakdown of all of the schools that have greater than 5% exemption. And I'm happy to provide that electronically, so you can sort that. That's where you see that these schools that have 33% exemption, well, they only have 3 kids in their kindergarten. So if one kid hasn't received all their vaccines, then that's going to jack up their exemption rate.
Any other questions? Thank you.